Well, another area in which we have disastrous things happening is population screening. Okay, so the reason why you do population screening is one of two things. Either you're trying to reduce the death rate, the risk of dying from something, or you're trying to reduce the risk of a comorbidity. Now let's talk about a population screening tool that's incredibly effective, Pap tests. In every area of the world where Pap tests have become the norm, you've seen the cervical cancer death rate just plummet. Now we do too many of them, and we act on the results in an inappropriate way sometimes, but the bottom line is that absolutely, I don't know anybody in the medical profession who would disagree with the widespread use of Pap testing. It should be done everywhere. Okay, so let's take a look at another screening test for women, mammography. Okay, so in spite of the fact that the United States spends $8.3 billion a year on mammograms, the death rate from breast cancer hasn't changed. It's appeared to change because of the shortcomings of mammography, which is that they find small masses that are contained, ductal carcinoma in situ is an example, that 88% of the time will not become cancerous. And then we treat these people as if they have cancer, and these women have surgery, usually lumpectomy, although increasingly mastectomy. These women have lumpectomies. They are given radiation, sometimes chemotherapy, sometimes hormonal blockade, aromatase inhibitors, that sort of thing. And so these women would be alive 5 years later, which is the benchmark, if you did nothing to them. So they go into the survival pool, and it makes it look like we're doing better. But if you look at the death rate from invasive breast cancer, it hasn't changed at all since we started spending all this money on mammograms. So the bottom line is it's a complete failure. And furthermore, because when you treat people who don't have cancer as if they do have cancer, there can't be any benefit, there can only be harm. So the estimate for mammograms is that for every woman you save, at least 3 women are going to be harmed by overdiagnosis and overtreatment. And some of the results of that harm are, for example, if you have radiation, it can increase your risk of heart disease. So how would you like to find out you now have heart disease which resulted from treatment for a condition you never had? So if you had never been swept into the system, there would be nothing wrong with you today. So I think in the case of tests like mammograms or screening tools like mammograms, women should see this before they decide if they want to have a mammogram. PSA testing is another one, and the situation here is even more despicable. I happen to be a personal friend of Dr. Richard Ablin. He's the researcher who discovered prostate-specific antigen. It's not a marker for cancer. He's been trying to tell that to people for a very, very long time. PSA has no usefulness in early-stage prostate cancer. In spite of that, we have taken the prostates out of about 1 million men in America, many of whom are incontinent and impotent, and they really didn't have cancer at all. So PSA screening, the U.S. Preventive Services Task Force first said it's inappropriate for men of all ages, and then with pressure from the Congress, which was pressured by drug companies and the people who make the companies that make the tests, modified it to say talk to your doctor about risk, but nothing's changed. It's a useless test. Colonoscopy, people are shocked when I say this, but there is not a single randomized trial that's ever shown that colonoscopy reduces your risk of dying of colon cancer. And there are studies that show that for every 1,250 people who have a colonoscopy, you save 1 life and you kill somebody else, because there are downsides to having colonoscopies too. Again, I think people should see this information before they get swept up into all of this diagnostic testing. Another downside of screening programs that I don't think we talk enough about is they're promoted as the thing that will save your life. So much so that people think that they can eat, drink, and be merry, have screening tests every year to see literally if they're still getting away with it, right? And then if your mammogram's clear and your blood test was all right and all that kind of stuff, then you go back home and eat some cheeseburgers and french fries and sit on the couch and see if you can get away with it for another year when you go back and be tested again. So there's a passivity that results from over-reliance on these types of tests, many of which don't really yield the results that people are looking for. The reason why doctors push screening tests is they believe that they're effective. But I always caution people in the health profession against practicing faith-based medicine. Okay? Now, as a person who has very strong spiritual beliefs and a very strong belief in and relationship with God, I don't want that statement to be misconstrued. But having said that, I think that we should use science and outcomes-based science to guide our decisions. And so that's the biggest reason, is doctors not thinking for themselves to look at these things and decide what they want to do. Now, I'm going to give you the other side of the story, because I'm hard on doctors, as you can tell from this discussion. So we have to look at the other side. Doctors are often expected to practice given the community standards of practice. They risk being sued if a person declines a mammogram and later has breast cancer. That's a risk that they all face. And they often work in institutional settings. In fact, most doctors today work in institutional settings where you really don't get to make those kinds of choices. So the institutionalization of medicine has caused many doctors to go along because they don't really have a choice. Well, the risks of imaging, many forms of imaging, are understated. So there are good reasons to have an image. There are good reasons to visit doctors. You know, if I had a pain in my side and it didn't go away in a few days, it appeared to be getting worse, I think I'd want to go have it checked out. But we are exposed to so much radiation, even dental x-rays, when you have them every year or two, are a bad idea. And the American Dental Association doesn't recommend that anymore. They're so conservative about, the organization, not the dentist, are so conservative about x-rays that they say that when a patient goes to a specialist, that the x-rays should be obtained from the referring dentist instead of having new x-rays done at the in order to avoid additional radiation. Obviously, this is more impactful with children than it is with adults, but you know, we started our discussion talking about the protein issue and nutrients. More is better. The imaging has gotten to that place too. There's a time for imaging, and it can be very, very valuable, but more is not better. Less would be better, and being much more responsible about it. One of the reasons that this goes on, and this is something else that's not talked about enough, is the fact that there is a perception in healthcare that nobody's paying for it. There's no price consciousness at all. People are completely disconnected from paying for things. Now, they pay insurance premiums, but they don't put together the direct, like, what it costs, all right? And if everybody had the ability to be a payer in a meaningful sort of way as a consumer, this would all start to change. You wouldn't see so much overuse of imaging, or other things for that matter. So I'll tell you an example of what I'm talking about. I have a friend whose wife developed a gynecological problem and was recommended she have surgery, and she decided this was the moment when these people decided they were going to listen to what I had to say about how to keep yourself healthy. So this doctor got very upset with her when she declined the surgery. He said, well, how are you going to know it works? They said, well, we found out about this through an MRI, so we're going to go get an MRI and find out how we're doing in a few weeks. And the doctor laughed and said, well, I'm not going to be a part of that. So these are intelligent, educated people. They figure, how hard can it be to get an MRI, right? So they go to the place where they got the MRI, walk in one day, said, we want to get an MRI. And they said, well, you're not on the list. Well, I guess you got to be on a list, right? Well, they said, no, we're not on any list. Well, you have to get a doctor referral. Well, no, we don't. I mean, can't you just come in here and get an MRI? Well, this just seemed to befuddle the whole place. So she goes and gets a supervisor, and this, you know, people are just completely amazed. So my friend says, well, what do you charge for an MRI? Nobody ever asked the question. They said, well, we usually just bill insurance. And they said, well, we're going to pay for it, okay, just cash money. So how much does it cost? Well, that took a long time. They came back and said it's about $2,200. They said, no, I don't think you understand. I'm going to give you cash from the wallet. They ended up paying $225 for an MRI. Nobody had, think about all the money in addition to the $2,200 for the MRI. Now you got to go get a doctor visit to be referred someplace, and they got a bill. So the bottom line is, we've made it so that nobody has any idea how much any of this costs. Nobody has a stake in reducing the cost necessarily, although everybody claims that they do. And so the overuse of everything is easy to do when nobody is actually paying the bill. You know, when you hire a plumber at your house, you're going to ask a lot of questions about what it costs, and if it's something major, you'll probably get another quote, maybe two, just to make sure, before you spend like $4,000 on something, right? We don't do that in medicine because nobody's really paying the bill.